Have you ever heard about the silent killer? Well, the silent killer is hypertension or high blood pressure. This one kills you without you even noticing. It damages your heart, your kidneys, your eyes, and brain. So, let's talk about the medications that are involved in high blood pressure. If the problem is volume, then we go with diuretics because diuretics reduce the water in your body. If the pressure is high, reduce fluid. Less volume equals less pressure. So we go with thiazide, hydrochlorothiazide. It's the first line for uncomplicated hypertension. It's mild, reduces sodium and water, and also loses potassium. This one is the best for long-term BP control. If the patient is hypokalemic, then you have to use potassium sparing because you don't want that potassium level to drop drastically. That could be fatal for the patient. So we go with spironolactone. This actually blocks aldosterone, and aldosterone normally saves sodium and water and dumps potassium. So when you block it, you lose sodium and water and you keep potassium. So keep in mind that you have to watch for hyperkalemia. This one is used for hyperaldosteronism, heart failure, and resistant hypertension. We also have the loop, which is furosemide. This is actually called the water pill. It's very strong. It's used for edema and heart failure. Not usually the first line for simple hypertension. And this one is used in dialysis patients to get rid of excess water in the body. Now, if the problem is hormone driven, then we go with ACE inhibitors or ARBs. ACE inhibitors are the ones that end with pril. And these block the pressure hormone, which is RAS. Low blood pressure, renin, angiotensin II, then aldosterone. Aldosterone keeps water and sodium but dumps potassium, as I said before. So when blocked, it dumps water and sodium, but it keeps potassium. So also, as I said before, watch for hyperkalemia. Angiotensin II is very powerful. It's a powerful vasoconstrictor, which means it makes your veins constrict. So they become very constricted. Therefore, your blood pressure shoots up. And it also stimulates aldosterone. ACE inhibitors basically block the formation of angiotensin II, so it doesn't stimulate aldosterone. So you end up with no vasoconstriction. So your veins, instead of constricting, they dilate, they become larger. So your blood pressure goes down. And it also reduces the volume of the fluids you have in your body. So your blood pressure drops. But this one actually, ACE inhibitors, they cause cough. Why cough? It's because basically ACE normally breaks down bradykinin. So when you block ACE, bradykinin builds up, which actually causes a person to cough. So when we have this person, then we prescribe ARBs. And ARBs are the medications that end with sartan, like losartan. And these ones block the receptor. Instead of blocking the formation of angiotensin II, they block where it binds. So it has the same effect, but no bradykinin buildup, so you won't cough. And if the problem is vessel tightness, then we look at calcium channel blockers, because calcium channel blockers help your veins relax. Basically, how that works is, so when calcium enters the muscle, it actually causes it to constrict. So when you block it, then there is no calcium going into the muscle. That means the muscle is going to dilate. And our veins are literally smooth muscles. So when there is no calcium that's going into those veins, then there is no constriction. You actually end up with relaxed veins, and that causes your blood pressure to drop into normal levels. We have amlodipine. This one is actually vessel focused. And then we have verapamil and diltiazem. And these two are vessel focused and they slow your heart rate. So they bring your blood pressure down and they bring your heart rate down as well. Not like amlodipine, which only brings your blood pressure down. Now, if the problem is heart, which is stress driven, we go for beta blockers. Beta blockers are the ones that end with LOL, LOL. These block stress mode. So they block your stress mode. They block beta 1 receptors in the heart. And what beta 1 normally does, it increases your heart rate and increases contractility, which means your veins become smaller and your blood pressure shoots up, and they release renin. So once you block it, your heart rate slows down, there is less force and less RAS activation. So your blood pressure ends up dropping. And this one actually masks hypoglycemia. So people with diabetes, if you give them this medication, the signs of hypoglycemia are masked and they don't show. Usually when somebody has low sugar, their heart rate usually spikes up and they get tremors. Beta blockers actually block tachycardia, so diabetics don't feel warning signs. That's basically what it is. Then we have alpha blockers. These open your veins, they open them up. Alpha 1 causes vasoconstriction. So when you block it, you end up with vasodilation. Instead of them shrinking your veins and spiking your blood pressure, you block them, your veins relax, and you end up with lower blood pressure. And the risk for this one is orthostatic hypertension. So basically, when somebody takes this medication, if they're sitting and they change position suddenly or very fast, let's say the person stood up, then their blood pressure drops drastically, which makes them feel dizzy and sometimes they fall. So what I would say to these patients is I would educate them about this and tell them to move slowly. If they're sitting and they want to get up slowly, so you don't cause your blood pressure to drop drastically and feel like that. Then we have central alpha 2 agonists, which is clonidine. I usually hear this a lot in dialysis because a lot of dialysis patients have super high blood pressure, so this helps. This one actually, what it does is it turns off the brain signal. So clonidine basically works in the brain. It reduces the sympathetic outflow from the CNS, which is the fight or flight. So it basically reduces your fight or flight. And usually when you get fight or flight, it means your blood pressure goes up, your heart rate goes up, and you get energized. So when you block it, that means you end up with low blood pressure, low heart rate, and you're just feeling normal. Why this is used in dialysis? Because it works very fast and it's good for acute spikes. But it's not the greatest for long term because of sedation and rebound hypertension if stopped abruptly. And that was it.